There can be many different causes of hair loss, whether it's hormonal in male pattern baldness or hormonal for women in sometimes the perimenopause or the menopausal stages. Sometimes you can have a temporary hair loss or thinning after a traumatic event, or sometimes giving birth in the postpartum period, and sometimes rapid weight loss can also help thin the hair and add to that hair loss burden. There's so many different diagnoses of hair loss, and sometimes with the alopecias and the more complex hair loss, if you came into clinic, I would be referring you to a dermatology colleague, but quite often there are things we can do in clinic, and there's things that we can really help with your hair loss journey. The things that I might recommend at home might include topical treatments like minoxidil, or might include some oral medications that are prescription. But there are a lot of things we can do in clinic. So to start with, we would possibly talk about light therapy. LED light therapy, especially in the red, near infrared spectrum, has definitely been proven to help stimulate hair growth and keep that hair growth in its growing phase. Hair comes in or goes through 3 different phases. So it goes through the anagen phase, which is the growing phase, the catagen phase, which is the dormant phase of the hair follicle, and then the hair follicle will shed in the telogen phase. Treatments we do in clinic, aiming in general to keep hair longer in the growth phase. So we increase its growth by keeping it in that anagen phase longer, and also by nourishing the hair follicle and stimulating it through different means can make each hair follicle itself thicker and healthier. There's lots of different injectables that we use for hair specifically, and usually in general, if they've found a fabulous skin booster that we put in the face, if we put it equally in the scalp, it can really nourish that hair and stimulate the hair growth. Some of my favourite things to do include polynucleotides, where we take fractionated DNA from salmon and trout and we inject it directly into the scalp. We also offer a PRP, a platelet-rich plasma technology, where I take some blood, I spin your blood in a centrifuge, and from your blood I take your growth factors, your own stem cells and healing factors, and take that goodness and inject it straight back into the scalp. That has a vast body of evidence that really does show that it really stimulates hair growth, and I've seen some lovely results in clinic. One of my favourite newer things to do is microneedling with exosomes. This is the latest in regenerative medicine. We microneedle it in, and the exosomes we're still learning what they do, but we think that it's how cells communicate. When microneedled into the scalp itself, it can really thicken that hair, stimulate that hair growth, and has even been shown to turn grey hair back to coloured again. So it's really anti-aging for both the face, when I do it in the face, but the hair as well. One of my favourite protocols in clinic has been something we've been developing over the last few months, and includes all of those factors. So part of that treatment process with us would include some PRP and some polynucleotides injected into the scalp, and then you'll come back 3 to 4 weeks later and have a microneedling treatment with exosomes. I might also at the same time recommend you doing some things at home with the idea of just stimulating that hair growth in all different directions to get that maximum result. And I've had some lovely results in clinic. It is important to come for a quick consultation first, just so we can chat about the hair loss to make sure it's something we can help you with, and then start you on that journey in the right way. If you've got any questions, we're always here. Thank you.